Hello everyone, this video is all about serotonin syndrome. So we will be discussing what it is, how it's treated and what causes it. So what is serotonin? Serotonin is 5-HT or 5-hydroxytryptamine, which is a neurotransmitter with a complex biological function. It regulates various activities such as behavior, mood, memory, gastrointestinal homeostasis, vomiting and learning. So it's involved in a lot of things and it's very important. Due to the wide range of processes, patients could potentially be on a number of medications that increase levels in the body. It's a primary target for psychiatric and neurological disorders, post-traumatic stress, anxiety, obsessive-compulsive disorders. It's been nicknamed the happy chemical because higher levels of 5-HT are associated with feelings of well-being and happiness. Imbalances are therefore linked to depression, anxiety and insomnia. So serotonin is tightly regulated in the body. Concentrations and activity is regulated by its rate of synthesis, release and metabolism. It's stored in intracellular vesicles. It enters the synaptic cleft after the neurons are depolarized and binds to a G protein-coupled receptor. Serotonin is then recycled back into the cell via serotonin transporter or SERT and either stored in vesicles or metabolized by MAO in the cytoplasm. So here we have two mechanisms for augmentation by drugs, monoamine oxidase inhibitors and inhibiting its uptake to make it hang around longer, such as SSRIs. So what is serotonin syndrome? It's a potentially life-threatening condition caused by excessive serotonin levels in the body. It typically occurs when somebody takes 2 or more medications concurrently that increase serotonin levels. I've got a list of interacting medications on the screen there. So for SNRIs, it's such things as venlafaxine and duloxetine. And we have over-the-counter cough medicines such as dextromethorphan. Your illicit drugs are things like LSD, ecstasy, cocaine, amphetamine, and dietary supplements such as ginseng, St. John's wort, and nutmeg. Now, I've popped on the screen there some food-drug interactions, and serotonin syndrome caused by food is highly unlikely, as the active compounds in these foods are really small, but it's worth taking note. So we have turmeric, saffron and tryptophan-rich foods, and these include turkey, chicken, soy, eggs, pumpkin seeds, peanuts and some cheeses. What are the symptoms of serotonin syndrome? Take note of these symptoms because it's often quite beneficial to warn the patient what to look out for. I won't go through them all, but you can see how widespread these things are. And in really severe cases, seizure and coma can occur. So how is it treated? It's worth mentioning that in minor cases, the patient may be kept on the 2 medicines with close observation, and if they're aware of the side effects, they just need to report them. Or also in minor cases, just discontinue and observe 24 to 72 hours. It should resolve. Anything more serious, we're on to supportive care now, and that needs to be in hospital. So we can administer medications to help with symptoms such as muscle rigidity, increase in body temperature, agitation, such as benzodiazepines, for example, diazepam. We have nitroprusside and beta blockers for an increase in heart rate and blood pressure, or serotonin blockers such as cyproheptadine. We have oxygen and IV fluids for dehydration and fever. Once treatment is administered, there's usually no problems and levels return to normal fairly quickly. So not directly related to this video, but for those who are interested, I'm going to just quickly discuss the abrupt withdrawal of serotonergic medicine or dose reduction. Abrupt withdrawal of these medicines can cause something called SSRI discontinuation syndrome, and symptoms are flu-like and can occur a few days after dose reduction or withdrawal and persist for up to 2 weeks. And I have a mnemonic to help with that. It's FINISH. So flu-like symptoms, insomnia, nausea, imbalance or dizziness, sensory disturbances and hyperarousal. Now, hyperarousal is not sexual. It just means an abnormal state of increased responsiveness to stimuli, such as increased levels of alertness, anxiety, and elevated heart rate and respiration.